It's a pleasure to be here today and I guess be the anchor, not that drags this down, but lifts it at the end. I was thinking about this, and particularly this last session, when I started in urban ecology 25 odd years ago, I reckon we would have got maybe 5 people in the room to start with, and then everyone else we would have spoken to says, why would we do that anyway? We can't afford it. The last probably 5 or 7 years I've been in consulting, ecological consulting, and a lot of the time this sort of green stuff gets included in projects, but at the end, when we're about to implement, we've run out of money, we can't afford it. So I'm really looking forward to what Associate Professor Patrick O'Connor the myth he's going to dispel now is that we can't afford green infrastructure. So Patrick, please come up. He is, as I said, an Associate Professor at the Centre for Global Food and Resources at the University of Adelaide. Over to you, thank you.
Thanks, Rod. Thank you, everyone, for being here and coming to listen. I'd like to thank Uncle Dave for the welcome. I'm very pleased to be on your country. I was the only one in the team that would dare to come across to this dictatorship, but it's good to be welcome when I get here. And the work I'll talk about today is substantially done on the land of the Kaurna people and some in the Ngarrindjeri and Paramount country. Taking Olivia's cue this morning, I would have rewritten this as we can't afford not to, so as not to repeat that myth. And the short version of this talk is fairly easy, which is that in an urban environment like Melbourne, if you did the figures properly, you would realise that the social welfare from existing biodiversity that still has functional attributes is already at a value above an alternate use. So our offsetting schemes are inadequate to capture a lot of that, and they're intended to be inadequate so that we can continue to produce private goods. But the public benefits already available from existing and probably from some retreat and improvement, re-establishment of biodiversity values is already there. It's just that the system doesn't work to bring those values forward. And one of the challenges there is that we are really faced up against a public provision problem where the private goods are discrete and they go to private individuals who know who they are, and at the end of the week, you know, if you made a real estate deal, you know you got paid. Even though most of the people in here work in biodiversity conservation, restoration, management, consulting, advising, your job at the end of the week isn't dependent on whether there is more or less biodiversity. Right? So that we're working in different domains, and those. And we're working on behalf of public institutions to act on behalf of public provision to overcome that market failure. So that's the short talk. It's already worth it. We already know it's worth it. It's that the system that we work in doesn't know how well to match up the problem of overcoming market failures against private incentives. But I'll do a long version as well. So they're the people who actually did the work. My name should be in smaller font, but they let me come and talk about it. What happened was that the Department of Environment in South Australia came to us and said, we'd like to put a value on our national parks. Victoria did it a few years ago. I don't know what effect it had in Victoria, but the National Park said we should venture into this space. They're very cautious of the economics. We did it for all the rural and regional parks in South Australia. There's 350 national parks in South Australia. Covers about 21.5% of the state. It's equivalent to the entire UK in land area. And we showed them that if you just look at the rural and regional, because we had a fantastic data set, probably we got lucky that we waited a few years after Victoria, and so we had a booking data set that gave us big data. So we had more than 800,000 bookings in each single year. So we could trace the origin of an individual to their destination, track their number of days, and put models almost on every journey to end up with a travel cost. So what's the value in the rural and regional economies of people visiting those places? And so we end up with around $450 million a year to visit parks outside Adelaide. The problem with the ones inside Adelaide is you don't have to book, you don't have to pay, and you don't have to go very far, and we don't know where you started your journey, so we couldn't use those methods. But what we had done for a few years was that we had been doing a recall survey of people and asking them, what do you do when you go to a national park in the Mount Lofty Ranges or in the urban? It's really, some of it is urban, some of it is fringe, and only a couple of the 20 parks that are included in this study are sort of outside what you would call urban, but they're all within fairly easy reach, but some are very easy reach. My wife goes to one 3 times a week and does a walk for about an hour, so that's a very easy walk, probably 8 kilometres from our house. These are the things that people say that they do. So we could put a benefit on all of the things that people do here and say what do they derive, how do they derive that benefit, what's the gain for them, and there's lots of ways that we could look at that. So the way that we approached this was to say, well, instead of tracing back down what they say they're doing and try to understand what's done, let's look at health as an outcome and what health value do we derive from all of these journeys to these parks in the Mount Lofty Ranges. But remember, we didn't have any data about who went because there's no counters on the gates and we didn't know where they started, so we had a bit of a problem. The other problem we have is that while there are clearly thousands of studies linking physical health, mental health and eco-health, very few, and there's a good number of them that are what I would call t-test type studies. You did it or you didn't do it and there was a difference, you measure it or you ask a recall, how do you feel better, is your asthma a bit better? Not so many get down to really clinical level gains, but there are some, and very few are epidemiological. So really looking at whole populations, really trying to understand through the mediating mechanisms. So if you go to a national park, as I said my wife does, she probably derives the benefits that she would report as life satisfaction or as a self-health rating. She derives them substantially from things like physical activity. She may get some of them from a peace of mind and a state. She might even get a microbiome recharge, but we don't have really good epidemiological data about all of those links. So we're working around in the dark a bit here. So my talk is going to put my glass jaw out there, and for all your critiques you can have at the end, the answer is do better and then we'll have another chat. So what we started with was a question which was, what's the reduced health costs associated with accessing these large biodiverse green spaces? So they're the blue ones. And the City of Adelaide basically goes around and some of them are inside, and there's a couple down the bottom that are a bit further away. But the main concentration of visitors is in those blue zones. In the year of interest, we had 2.9 million visitors to those sites, and I'll show you how we worked that out when we had no numbers. But to understand to answer that question, what we need to know is the amount of health that's gained from an access. We need to know what the health gain is worth in a dollar term, which is tricky, and then how many people actually made that gain so that we could work out what the value would be. So we have some life satisfaction and self-health rating data that we collect over time, and it also turns out there's a national census that collects similar data. So we have comparable data for people who visit parks and say that they visit parks and tell us a whole bunch of other things about themselves, and then the general population. So we can work out a differential for people visiting parks versus not visiting parks is one of the things. And we haven't done the life satisfaction, but we've done health. So we have that data. We have the annual visit data. We have population level survey data, both with that self-reported health status. We have health expenditure data for the 10 diseases in Australia, and we can break that down for South Australia. So 10 diseases that are sort of related to lifestyle and activity related diseases. So we can treat that as a health burden that we could tackle. It's not pregnancy, it's not breaking your leg. And then we worked that we could work out mobile phone ping data. So your mobile phone, so we're tracking all of you today and we'll be able to do something with that as well. But what we can do with mobile phone data is we can, only about 5% of your phone ping when you're in a national park. And so we used some hierarchical Bayesian models to work out how many people were actually in parks, and then we used some areas where we did have number data to train those models to work out how many people must have been in our parks at a given amount of time. So then we can get real numbers. So that's where that 2.9-ish million visitors to these 20 locations in that year comes from. We can see that there's a relationship, a little bit complicated relationship, and there's some confounding effects there. This is a jitter diagram showing the visits per year from individuals reporting their visits through the recall survey versus their self-reported health status. So you can see that some people with poor health do go to parks, and some people with good health don't go. And you can also see that there's a sort of there's a concentration there in the very good to goods in the low to medium visit, right? So we can work out that there's different kinds of people going. Actually, from the mobile phones, we can, whether we should or not, we can work out quite a lot about demographics, but we have left that alone for now. But we do know where the phone sleeps, and we know where it was at the time that it pinged, and so we do know quite a lot. Health statistics are fairly easy. So South Australia's, what's that say, about $3.5 billion on the 10 top chronic illness problems. That's what we're spending. And I've broken that down there by the index of relative socioeconomic disadvantage. So the more disadvantaged, the lower the number, the more health burden people tend to have. And so we've tried to differentiate there. Where are these problems most, and where is the biodiversity? So we're sort of looking at the equity of access to this type of what we might call high quality or high utility biodiverse space, though there are many other spaces. So we've got that. We've got the ping data. So just to show you, to scare you a little bit, here's a little island just off the coast down south, so it's not one of the parks, and it shows you the accuracy. So that's a causeway across the water there that you can see that line. That's how accurate it is. It's sort of within 20-ish metres, we know where you were. So the next stages of this work is to say, we know where people are concentrating their time. Well, what are they doing there? What are we getting out of that? And we can go and then develop other questions and start to ask, what values are you deriving? It's kind of reverse nature prescription. We can look at what people do and then back transform to why would they be there. There might be a lookout and things as a simple answer, but there might also be, amenity values, biodiverse spaces. There can be all sorts of things going on there. So we've got a lot of data. We've got the ability to look at it. We can work out what the reduced health cost is from that by looking at the differential of people who go to parks versus those who don't in their health categories by their relative socioeconomic disadvantage. And we calculate there's about $140 million for those 20 parks in that year in health reduced cost. So we could say voided cost. So the department is not brave enough to go to the health department and ask for 140 mil. I've encouraged them to do it. But I was in a meeting recently with someone in the department who didn't know that I don't think that we did this work, and they said, we're thinking about putting buses from the low socioeconomic areas to parks every Sunday because we're seeing that there's all these health benefits. And so I think the message starts to get through that if you can present a value, and I will say that that number is it's only health, so there's lots of other values. It's a price, if you like, so it doesn't represent the value, it represents a price. Price is not the same thing as value. It's very conservative, even though we have some confounding influences in that data set, because it doesn't count the cost of social housing for people with chronic illness. It doesn't cover the NDI, or NDIS. It doesn't cover a whole bunch of other things that are about health. But it gives us a pretty big number. And the number for actually managing those 20 parks is probably somewhere between 5 and 10 million in a year. So in terms of what the state spends on it, they're deriving an enormous saving in the health system they don't recognise. They don't know about it, and they're not prepared to act more boldly on protecting more area or managing it differently or even improving the facilities at named sites. Let alone all those other small biodiverse areas, all of those places in our landscape that we could be getting values from. So the number is not right, but I'm going to say it's right, and you have to have a better number to tell me it's not right. It's conservative, so it's a low number, right? It's probably not lower than that because there are many other things that would contribute to this, and we took a fairly conservative approach. The other thing that we're drawing out of this is that the number of visits and the median visits there by those deciles of relative socioeconomic disadvantage, we're able to look at that And you can see that if you are lower socioeconomic disadvantage, you are not as likely to be going to one of these sites, because they are, of course, near, there's a hedonic effect where people with more money live nearer to more biodiverse places. So there is an equity of access issue in here that we can start to tease out. So you can see that that's a very strong effect coming through there, and it helps us to understand that essentially most of the visitors are living within 15 kilometres of these large areas. It doesn't mean that any or all of these people aren't going to other biodiverse spaces and deriving values, including health values. But what would we be doing about those lower socioeconomic status locations, and how would we think about that? And there are options there for substantially increasing biodiverse spaces within reach of some of the lowest socioeconomic areas. I'll just add that we also did a willingness to pay calculation. So this is just a travel cost method. Now this isn't highlighting, but it adds up to about $40 million. That essentially even those people who are travelling on average 15 to 30 kilometres to get to one of these places, they drop some money in the economy doing that. Now, not all of that drop is what we might call environmentally good. Some of it's just driving your car, but they leave that in the economy. So that's generated in the state. So it has a value. Whether you take it at 40 million without subtracting other costs is another issue. But what you can also see there is that you can see the effect of socioeconomic disadvantage. And you can see an effect of the number of visits that you get about what your willingness to pay is. So this is essentially a way of looking at what are individuals prepared to pay to get that health benefit, or to get the total benefit of which part of which is the health. And so we start to be able to use those numbers to say actually people are deriving these. Individually they're not very high, are they? But adding up to 40 million in this case, or 120 million of the health gain is substantial. Where we've got to there is now we have a number, and the department is cogitating on that number a bit. They're a little bit nervous about it because it's not a causative study. We don't have the big epidemiological study that says over 15 years 2,000 people derived 0.6% of a health gain from access, and we can separate that from their diet and their drinking behaviours. But what we can do is start to talk to local government. So that's what we're doing now. So this is just two maps showing the ping data, where we've broken it down by two types of catchment. So we've got a catchment which is a national park, which you can see on the left. So that's Belair National Park, and who visited Belair National Park? And where did they come from? What local government area did they come from? So all those numbers there, I don't know if you can read the numbers, but there's nearly 100,000 visitors from the city of Burnside around that national park, going to that national park in that year. So now for that local government area, we can say that park is generating values for this many people in your area. Do you want that number to go up? Do you want it to improve its quality? What are you looking for? And you can see that it spreads out across Adelaide a little bit differently. And then the reverse of that is the flip, which is that if we take a local government area and say where are they going from that? So how do they disperse from their home location out? And so that we're doing that as well. And now we're starting to engage with local governments about, because the difference that the ping data gives us is that we can put real numbers on this. So we're not making up how many people there is. We might be making up how much health benefit there is. But given those assumptions and transparency about how you come up with that, the number of people was a very big multiplying effect. So that's where we're at with the conversations. And when people see those numbers, they say that is a lot to us. That would be a lot in our budget. When I go to my CEO and ask for my parks budget, they say it's at the end of the line. It's this much. It's not. It's going to be this. We're not going to do many new projects this year. But if you can show that you are a supplier of services, or you have a demand in your community for services supplied in or nearby. In this case, it's national parks and local governments who are not the same relationship, but we can do the same for any other space. So we're working towards those conversations. So at the end of all that, the problem isn't that we don't have the value. That value far exceeds the cost of maintaining those assets. So there was never an argument that we shouldn't be maintaining them, though they are often under pressure. There are many other assets that we didn't look at that also have high values, but we haven't drawn those forward. But they would also be value above cost for maintaining them, even if you only probably look through the health lens. So the answer is that it's a problem of public, the externalities from privatising land and those challenges, and that we have to fortify our institutions for public provision so that they seek these benefits. And not all of them are through financial incentives. Some of them are just regulatory. I mean, a regulation that said your next planting in your streetscape must be to a standard of this, that's a very different game. And that moves that cost into the market, and the market just adjusts and absorbs it. Okay, so the answer is we really can't afford not to be doing this, and we've probably gone past the point when it was even money. Thank you. I better say that was from Adelaide.
Yeah. Great. We are going to move straight into the panel. If you have any questions specifically for Patrick, do put them in on the app. Or we've got people who can run with microphones. Yep. While our panellists are coming up, if you wanted to turn your phone off so that you can go to the pub and no one knows that you're doing that after this, now's probably a good time to do it. But on our panel this afternoon, we have Tony Varcoe, who is the Director of Community Programs and Partnerships at Parks Victoria. I'm really looking forward to seeing your response, Tony, to some of the numbers that Patrick was able to calculate. And we've also got Dr Melanie Lowe, who is the Vice-Chancellor's Senior Research Fellow at the Centre for Urban Research at RMIT University, just down the road. So first, maybe to you, Tony, any responses or thoughts, reactions to what we've just heard?
Thanks, Rod. Can people hear me? That's better. Look, it's great to see this work from Patrick and co. I think the work that was done was building on some work that we did a couple of years earlier. And I go back to that pretty fundamental question. And firstly, I think this point about public good, it's a really tricky one, because public good value is often hidden in many, many parts of society and many, many parts of the economy. And that's been our problem for a long time. So I go back to a question our CEO asked me a few years ago was, and it was after several years of constant budget cuts, essentially, and it was really this question of how do we better quantify the benefits of our parks to Victorians, and how do we quantify the return on investment to the state and to the community? And I said, well, how long would you like me to? How long have you got for me to answer that one? And so we did set out on trying to at least set a framework for trying to do that. And I guess, going back to this question of value, really thinking about this question of, there are some things that you can create metrics to measure the value of something that aren't monetary, and you can get into this. There's this whole debate out there around putting monetary values on biodiversity values, and I'm not going to get into that, but there is a debate out there. You can also capture value through existing systems, like the GDP, and unfortunately the GDP doesn't measure public good value very well at all. There are some things that we can do. So, for example, some of the work that we did around nature-based tourism was through things like satellite accounts through the GDP. We could actually extract out that the value of our parks in Victoria were contributing something like 20,000 jobs to the state, as well as around contributing $2.5 billion per annum into the Victorian economy. So that was a very conservative figure as well. If you think about the cost of, say, our urban parks each year, It's around about roughly $150 million each year to manage our system of urban parks. We manage both urban and national parks. So even just the nature-based tourism return on investment was really good. But we actually delved into some of the other areas of ecosystem services as well. So we did things like, so if it wasn't for our metropolitan parks, our urban parks in Melbourne, and that was a different land use, what would it cost to, say, replace the role of those metropolitan parks in filtering pollution or managing stormwater? And so, for example, with filtering pollution, we found that those metropolitan parks can filter out something like 85% of the nitrogen that would have gone into waterways in the bay. And we could cost that out at around about a minimum of about $40-odd million per year. So, you know, there's that. With stormwater value, if it wasn't for the role of our metropolitan parks in actually regulating stormwater, we would actually have to double the brown infrastructure, if you like, the traditional infrastructure to move that water, and we could value that at around another $50-odd million a year. So, you know, there's plenty of ways that we can demonstrate, and if you looked at you know, those range of areas of value, whether it was pollination, whether it was those regulating services, but also those things like the recreation value, we were getting, you know, upwards of a return on investment of at least 20 to 1. The challenge, though, is we can have all the figures that you like, and what we've got to do is, I guess, look at this question around measuring, showing measurements, if you like, back to government, both in terms of, I guess, the rational brain side, how much does it cost versus how much do we get back, but there's also the other side of that, and that's the emotional brain side. How do we connect the community to nature? And the work that Patrick and others are doing on that, and others, is a really important part of that total equation. I remember a couple of years ago, the head of the Productivity Commission said to me when we were doing this work, no politician ever just used evidence. You need to hit them in the heart as well as the head. And I think that's how do we measure both of those two things is a really important thing.
Thanks, Tony. Melanie, what's your thoughts?
Just checking. Okay now? Yeah, thank you. Look, I think Patrick has, you know, beautifully encapsulated this idea that we can't afford not to do urban nature and urban biodiversity, particularly from the health and wellbeing, public health arguments and the economic arguments. So my research area is healthy and resilient cities. So I come at these questions from that kind of public health and urban resilience angle. But really, I think for me, the take-home message is that non-communicable diseases, and as we've seen in the pandemic recently, infectious diseases, they are a huge cost to society. They are also the leading, non-communicable diseases are the leading cause of death and disability. And we've seen Patrick provide some really compelling arguments about how nature, and parks in particular, can be very cost effective at mitigating those costs, those healthcare costs. So, you know, I think those public health arguments can be a compelling part of this story, in addition to the intrinsic value and of nature itself. You know, these are really arguments about the human and environment interaction. But I also just wanted to talk about you know, it is great that we have these wonderful parklands and reserves, but in increasingly dense urban environments and where the majority of the population will increasingly live, you know, we don't all have access to these beautiful, you know, parks close to home. And we've seen that, you know, there's really established evidence that you need fairly regular doses of nature to have those restorative benefits. And so I would argue that we need to, in addition to thinking about parks as part of urban nature, but also think about embedding biodiversity throughout cities, including in higher density environments, which we traditionally haven't perhaps prioritised in terms of thinking around green space, nature, because that's where potential, you know, there could be really potential benefits. And I just wanted to also touch on a couple of really, you know, I think, costly issues that we should discuss in addition to what's already been covered. And that the first is around urban heat. It's a big health and environmental problem. And it will become more so as the climate warms in countries like Australia and in cities like Melbourne. And we know that green areas, tree canopy, are not just protective and restorative for urban biodiversity, but also cool the city. So there's those really important benefits for health, and therefore by mitigating a very costly problem, it creates another argument for why we can't afford not to. And then I think we don't need to go further than look at the pandemic. We know it was a major disruption to urban lifestyles, our economic and social systems, let alone the direct costs on lives and healthcare. And we know that it was probably a zoonotic condition. It jumped from animals to humans. Urbanisation is sort of, I suppose, implicated in concerns that we will have future pandemics, and they may be more frequent and they may be more severe. With loss of biodiversity and climate change, there is that increased risk of the spillover of diseases from species and then jumping into human populations. So, if we're talking about prevention or curbing of urban expansion so we don't lose natural habitat areas, protections of biodiversity and prevention of the loss of endemic species is a really key urban question, and one that actually may in future prevent some of that disease spillover and prevent future pandemics. So, I think, has there been a more costly problem for society? And this is part of the solution. So I think we should really look at those broader social benefits as well as the healthcare and economic benefits of what we're talking about today.
Thank you. There's a couple of questions that have come in, and I'm going to paraphrase the first one because I thought of the same question, but the bit that I'm adding to the question is I'm yet to meet a park manager or a ranger who says, enough already, I've got too much money, stop giving me money. So how do we've got an overwhelming body of evidence that says the return on investment of green infrastructure and parks is just ridiculously great. Why isn't this translating into, boots on the ground, four-wheel drives in the bush, as in, manager four-wheel drives in the bush? Any insights?
I'll have a first stab. They're disconnected decisions. So the benefit to health is counted in one hand, and the cost of the infrastructure is in a different hands. So sometimes different institutions, sometimes in a different budgeting arrangement. We also are drawn to acute problems over the diffuse problem. So we'd rather biodiversity got slowly worse and we probably won't even know. Whereas if somebody's got a broken leg, we're going to act straight away. So there's just some sort of behavioural issues in there about how we do that and the way that we've set our systems up to make decisions. And like as I said before, that even though a parks manager is responsible, they don't have the same private stimulus for acting to draw resources to that source. So I'm not mean that they don't want to, but if you're up against somebody who's going to build a 20-storey building and make a mozza out of it, you're in a tough battle there. And so only by reinforcing the institutions can you start to win that battle.
If I could just add that on that question around the systems problem, we've had a number of conversations and we've got some agreements with health departments around trying to work on this solution. And I've been to numerous examples of conferences and others where everybody in the environment sector says, well, why can't we have a slice of the health budget? And the health budget, the preventative health budget in Australia is about 2% of the entire budget. So 98% of that is going into primary care, hospital wards, fixing the symptoms, and 2% is going into solving the chronic problems of the future. So the health experts would say, well, at the moment we can't give too much because we haven't got much to give in preventative health. So I think what we've got to do is do more work across those two systems because they haven't really talked to each other very well in the past.
Yeah, the only thing I would add to that is I think it's also kind of a temporal or a time-based question that often the costs, to actually, do conservation or to actually not develop a piece of land, there's these kind of trade-offs between what might actually be quite a costly endeavour to immediately, and then what we're talking about is benefits that are deferred and long-term and not very clear. And we often have this problem in public health, but I think you also have it in a whole range of aspects of conservation because, we're talking about intergenerational benefits. They may be hard to see and hard to measure over a short period of time, and so decisions that are made now about the hip pocket often are, in conflict with those long-term objectives, and often the short-term objectives kind of win.
Well, I might have sounded gloom and doom. The Victorian government at least has recognised some of these issues around longer-term benefit, and they've introduced a whole series of what's called social prescribing trials, and part of that is what we call nature-based social prescriptions. And so there will be a series of trials rolled out over the next couple of years where, in fact, our parks and our green spaces will be the settings for tackling questions around things like social isolation and mental health and the like through the health system as well. So I think there's some, we're early days, but I think there's some positive light there.
I'll just add one thing, which is when we were encouraging the department to go and talk to health about there is real value here, how do we talk about that differently, and they're a bit nervous whether they could really argue that there was a big health benefit. I said, well, then just close a park and make the complaints line in the health department, right? And then they'll get the message that when you close a park, people ring up and say, I've missed out on my aerobic exercise, my well-being opportunities, my time with friends and family.
It's interesting that the discussion, and I guess, Patrick, your presentation was, about the health benefits, but I haven't heard any. Well, if I've heard it, I've missed it. I don't remember it. But we're talking about health, the health budget, with the nature budget, if you like. There's plenty of other places we could be, tapping into some of those extra funds to divert that way. Any suggestions on where that could be? Some of those, I guess we're talking about some of the other financial benefits of green space.
Yeah, I think traditionally we've gone straight to the government. We've gone to the government to, people said, well, we pay our taxes and various other things, but they've gone to the government to get funding for additional programs. And I think what we're now starting to find is that insurance companies, superannuation, some of the big corporates are starting to realise the benefits of community engagement and engagement in real things like connection to nature. And so the growth of the non-government sector in certainly private land conservation is growing enormously, and is in fact at about the same size as the public land estate now in Australia. But I think what we're going to see is the non-government sector is going to start stepping in also, hopefully, to support at least some trials to get these up and running as well. But what we've got to do is we've got to give some real good life examples. And as I said, seeing case studies and practical examples of where people have personally benefited from connection with nature is certainly what we need to be doing.
Yeah.
Sorry. Well, I would just add that I think what was mentioned, that, we already know that a lot of the composite of what people talked about today, really, about smaller patches, green infrastructure that has multiple outcomes, those things, we already have pretty good economics about what gain we get in reduced nitrogen and therefore when it's worth doing. What we often don't do is add to that what is the benefit to local people to access that site at the same time as we get the green infrastructure to reduce the nitrogen. So when you start stacking those things together, you get a more compelling argument, and then it does go across portfolios So I picked the health argument to make something very, in ecosystem services, it's even nitrogen reductions in the catchment is pretty remote to most of us, but we know what it means to have a chronic illness.
Good. Okay. Back to the health side of things. We talk about some of the health benefits. What are some of the negative? I mean, the question here was around mental health impact of forest clearing, and I suppose we could talk about the same with climate change and the future and some of the stress that's causing. Is there a flip side to this as well? And can we? I'm not really sure how to frame the question, but
do you mean are there disbenefits from biodiverse spaces?
Well, it's not a disbenefit, but we talk about the positive. Maybe it is a disbenefit, but it's more about the positive things of green space. But what about, can green space maybe help combat the negative impacts of the stress associated with, the declining environment, perhaps? Is it enough?
Yeah, so I don't know if it's enough, but there's definitely a lot of work on how people feel after disaster and how they use nature as a way of dealing with that. I mean, the pandemic's a kind of example, but I looked recently at a large fire which was in a largely agricultural landscape in South Australia, and the final report's main thing was to immediately revegetate around the towns. So just bring it back. So even though not much of that landscape was traditional leftover biodiversity, if you like, the remnant, that was the main thing for mental health recovery. So I think that there's thinking about that.
Yeah, great.
What I will say, and I see Uncle Dave there, we're playing serious catch-up here, because what we're essentially starting to talk with, we're starting a conversation that our traditional custodians have been talking about for millennia, and that is that healthy country is healing. And what we need to be doing, and so whether it's major fires, floods, a whole range of other, climate change issues, getting your hands dirty and the social connection that happens with that and the flow on mental health benefits, creating new custodians, if you like, that weren't connected before. All of these things are really important that our traditional owners have been doing for thousands and thousands of years. And so I think there's an enormous number of lessons that we can learn how we can actually do that better.
Melanie, final word for the panel?
Look, I maybe it's just my skewed perspective, but I would say that mostly I just see co-benefits of this stuff. So we've had a focus on this panel talking about health and healthcare, but we're really, across the audience, coming from a range of different perspectives and sectors and disciplines, you can see the benefits of what we're talking about from all sorts of different angles. And I think the challenge is then, articulating that, building coalitions around that, and then importantly also I think what we've touched on here is appropriately accounting for that. So in the actual accounts, making sure that we're looking at both short and long-term benefits, that we're not like depreciating assets like trees like we do a table or a chair. They're different types of assets that governments and communities should protect and look after. So wanted to leave with that, just the co-benefits that can be achieved.
Great. And the final question, which I'm going to ask it, but I'm going to recommend that we take it to the pub, because it reads, reinforce the institutions, ! How do we transition to a socialist society to protect nature? I reckon that could go on for a while. So we'll save it there. Please, I'll hand back to Kelly with a few explanations of things, but A round of applause, though. That's right, yes.